Hello, I'm Dr. Anil Guri. I'm a consultant in reproductive medicine, surgery and assisted conception at the Homerton Fertility Centre in London. So today's topic is slightly different and it tries to answer the question, can we do a frozen embryo replacement cycle immediately after a failed fresh cycle? So what it tends to answer is, it tends to answer a question which is quite simple. It is, you've just finished a fresh cycle, you transferred an embryo and that embryo has not implanted. In the very next cycle, can you start the process of replacing the frozen embryo? Now, what do we normally say? We normally say, take a break of 1 or 2 cycles and then we'll start another cycle. Now, is that based on the psychological recovery or is it based on pure science? And that is something which is debatable. So this was a paper which was published on RBM Online, and it looked at a modified natural cycle, cryopreserved embryo transfer. Is a washout period needed after a failed fresh cycle? Now, what has been achieved? Over the years, we have had advances in cryopreservation, but there's been no optimal agreement, the best way that you could prepare the endometrium for a frozen cycle. In fact, if you look at the review which I have done, none of the methods are superior to any other except that the cancellation rate changes. And what we still don't know is what happens to the ovary and what happens to the endometrium immediately after the IVF cycle, and those dynamics are still not very clearly understood. So you'll see multiple different names being used, and they call it the spontaneous natural ovulatory cycle with frozen embryo transfer, or it's called an HCG replacement, where you stimulate the ovaries and you give HCG, there you call it a modified cycle, or you can stimulate the ovaries, or you can do a programmed cycle where you give estrogen or you downregulate. And if you see, there are many different options that you have. So the question a patient will come and ask you is, should you delay the frozen embryo replacement? And traditionally what you've said is, we believe that there may be negative impact on the endometrium and whether or not we should use HRT. So what was the aim here? The aim was to compare the characteristics between natural cycles that immediately followed a failed cycle and to compare the outcome of either waiting or doing an immediate embryo transfer in the very next cycle. So this was, in this paper, patients' age group was 18 to 45 years. They excluded donors and PGTA cycles, 198 cycles. Group A had an immediate transfer, which means less than 22 days. And the way they calculated it is over, egg collection plus 14 days plus 7 days. And 80 patients in which after the embryo replacement would happen later. So the protocol was follicular monitoring, lead follicle more than 17, HCG was given, or if estrogen of 550 pmol or progesterone levels less than 3.2 nanomole. And what you're looking towards is that there is no premature luteinization or premature ovulation. And those who ovulated spontaneously, they wanted to see a slight fall in E2 just compared to the previous one, and a rise of progesterone greater than 4.8. Again, when does the progesterone rise? Just before ovulation, the rise starts taking place. We know that from the analog trigger, and the disappearance of a follicle or an ET more than 7 millimeter. Utrogestan 200 milligram was given as luteal phase support. Now, if you look at the results, and in both the groups, your clinical pregnancy rate and the live birth rate were not any different. And that is something quite interesting. So at present, how do we conclude this? And we say, well, do we know the best protocol? I don't think we know it. Can we transfer immediately? It seems promising. And the concepts of whether there would be a negative effect on the endometrium have, I think, been ruled out. The problem is if you use a modified natural cycle, your challenge will come in detecting ovulation. And in fact, two retrospective studies also commented that if you follow a fresh failed cycle immediately with an HRT medicated cycle, results were very similar. There have been people who have had concerns about immediately following. At the end, what I would have to say is, looking at this paper, that it gives you a reassurance that if you were to follow the cycle immediately, there does not seem to be a negative impact on the endometrium. So that is in short what this paper tends to convey. I hope you've enjoyed this paper and you've enjoyed this talk, and if you do like it, please share it and like the page, and thank you very much.